Okay, today we will have the muscles, the nerves, and the vessels of the face. Okay, first we remove the skin. We have the fascia that covers the muscles. Here we have the fascia covers the temporalis muscle. Here the fascia that covers the parotid gland, and here we have the fascia covers the mastication muscle. Okay, and here's the fascia for the buccal muscle. Okay, when we remove the fascia, we'll have nerves. In here we have the supraorbital nerve. This is the supraorbital nerve. Okay, opsa. This is the supraorbital nerve. Okay, which passes from the supraorbital notch. Okay, and in here we have three germinal nerves. Okay, we have also the maxillary nerve, which has the infraorbital branch, infraorbital nerve. This is the infraorbital nerve. Okay, which passes from the infraorbital foramen of the maxilla, which is a branch from the maxillary nerve. Okay, and you have the facial nerve, which has 5 branches. The branch of the facial nerve are like this: the temporal branch, the zygomatic branch, the buccal branch, the marginal mandibular branch, and the cervical branch. The cervical branch passes to the cervix and supplies the platysmus muscle. Diarnia, and we have the temporal nerve. Okay, this is the temporal nerve. Okay, and in here we have the superior to the parotid duct of the parotid gland. We have the zygomatic nerve, and inferior to the duct we have the buccal nerve. This is the buccal nerve, the buccal branch of the facial nerve. Okay, and in here we have the mandibular, the marginal mandibular nerve. As we mentioned, the cervical passes to the neck and supplying the platysmal muscle. Okay, and also we have the artery. In here we have the facial artery, which is found anterior to the facial vein. Okay, and it is found anterior to the margin of the masticoid muscle. This is the facial artery. This is the facial vein. The facial artery in here gives the infralabial artery. Okay, this which has a tortuous course. يعني هم بيت supernatural ده. We can say little psi branch can be illustrated that. And deep to the buccal muscle, we have the buccal nerve of the maxilla. Asha. Channel. This is the buccal nerve of the maxilla. Okay. We have the buccal nerve of the fascia, which is inferior to the parotid duct. Okay, and this is the buccal nerve of the mandibular branch of the mandibular nerve. No, of the mandibular. Maxillary, it has only the infraorbital. Sorry, I mentioned wrongly the first. Okay, so as I'm telling you, this is the parotid gland. This is the facial covering. Okay, this is the part of fat, the buccal part of fat, which prevents the collapsing of the face during sucking the milk in the case of the fetus. Okay, in here we have the muscle fibers, the ocularis, okay, which are circular muscle fibers, and in here we have the orbiculi oris. Orbicularis oculi. Okay, in here also we have the facial artery, which gives the anterior superficial temporal artery, which passes to the anterior eminence. Okay, and the posterior superficial temporal artery, which passes to the lateral eminence. Okay, parietal eminence. This is the frontal eminence or the anterior eminence, and this is the parietal eminence or the lateral eminences. سيدي حبه لكن أولى variation يكون nerve. Okay, in here the parotid gland has 2 ducts. Okay, this is a variation. This is one of the ducts, and this is the second duct. This is the ducts of the parotid gland, and in here we have the ocularis, auriculotemporal nerve. Okay, this is the auriculotemporal nerve. This is the auriculotemporal nerve. Okay, which passes posterior. to supply the posterior of the auricles.